Social Security and Medicare trust funds are in dire financial condition due to rising benefit costs, but the biggest problem facing the two largest federal entitlement programs is how they're funded, according to a nonprofit that advocates greater government transparency and accountability. They said, quote, "Our bottom line is the trust funds are a shell game. There is no money in the trust funds. As former U.S. Comptroller General David Walker says, trust funds have no funds and should be distrusted," close quote. This quote was stated to the Epoch Times by the president of TIA, Truth in Accounting, on September the 2nd. Weinberg was referring to the fact that the trust funds receive what are in effect IOUs from the Treasury Department that are called securities, promises to pay a specific amount at a future date. On Social Security, for example, the government pays interest on the securities, generally around 2%, and the total value of the securities is presently less than $3 trillion. Securities are paid out of general revenues when they come due. Quote, "We would also highlight the massive underfunding. Social Security is underfunded by $40 trillion, Medicare by $55 trillion. This represents the amount of money the government has promised in benefits, and they have no idea where they're going to get the money to pay for those promises," close quote. This comes again from Weinberg. The official U.S. national debt is $29 trillion, but the Weinberg's group maintains that the true amount is more than $133 trillion when the cost of benefits, such as those promised by Social Security and Medicare, are included in the calculation, according to the Chicago-based TIA. Private sector pensions are required by federal law to account for future benefits and properly fund them, but the federal government doesn't follow the same law for its own pensions. Medicare has the largest unfunded benefit total at $55 trillion, followed by Social Security at $40 trillion, and the government employee and retiree pensions, such as civil service retirement systems, at $9 trillion. The public debt and assorted other federal liabilities, such as loan guarantees, make up the balance. Trustee reports made public earlier this week show that the Medicare Trust Fund pays for hospitalization is due to reach insolvency in 2026, while Social Security Trust Fund will reach that point in 2033, barring major reforms in how the two programs are funded and pay benefits. Weinberg is far from alone in pointing to the unfunded debts of Social Security and Medicare. Yesterday's reports on the financial status of various Medicare and Social Security trust funds once again identify unsustainable benefit promises to Medicare and Social Security programs. Senator Mike Capro said in a statement on September the 1st, quote, "The hospital insurance fund is projected to be exhausted around 2026, and there are $60 trillion of unfunded liabilities in Social Security programs, and unfunded liabilities increased by trillions of dollars over the last year alone," close quote. Capro is the ranking minority member of the Senate Finance Committee, which would be a major player in any congressional or presidential initiative to reform the Social Security and Medicare trust funds. President Joe Biden hasn't offered any proposals as yet to reform the funding underlying either Social Security or Medicare. For Headlines with a Voice, in memory of Nancy Morgan Hart, I am Felicia Lockhart.